to make sure that we can provide timely and exceptionally competent emergency service. So I think that's it. She's going to talk about laminitis today, which will be topical in about 6 weeks. That's about it.
Okay.
Thanks.
All right. So do you want to maybe just hit those lights just so they can see that a little bit better? Great. Okay, well again, like Dr. Davis said, thank you all very much for coming. And we are going to talk about laminitis, as is an appropriate time of year to talk about this. And I know that the slide says prevention and treatment, but we're really going to kind of cover the entire thing. So we'll go through some of the proposed mechanisms, as well as some of the risk factors and the signs to look for too. And the goal here, if you're not very familiar with this, is hopefully to prevent this from ever happening in your horse. But if it has happened, certainly to take some measures if the horse does need to be treated, to do that as soon as possible so that you avoid things kind of escalating and getting worse than they need to be. So, all right, give me just a second. I've gone into a little bit of sleep mode here, but hopefully not. Okay, so laminitis is a fairly common disease that we do see. It is kind of depends on the part of the country to a certain extent, but it is pretty uniform across horses, and we'll talk about why that is. Something that is important to note, I think, is that some cases of laminitis are actually preventable. So management factors do play into this, and that's an important thing to keep in mind as we go through this. The other thing I will mention too, if you all have any questions as we go, I am happy for this to be informal. So feel free to put your hand up, or if you want to wait till the end, I'll be certainly happy to take questions at that time as well. So one of the common causes of laminitis is overfeeding, or horses that get too rich of a diet, too many carbohydrates, too lush of pasture, things like that. And those are certainly factors that we can control. And so my goal for all of you from this talk is to learn more about laminitis, again, causes, signs, and treatments, and so that it can be prevented, which is again very important, or to minimize the risks or damage of laminitis in your horse or horses if it does occur. So laminitis literally means inflammation of the laminae. And what the laminae are, without getting too anatomically heavy on you, but these are structures that connect the coffin bone to the hoof wall or the hoof capsule in the foot. So you can appreciate that if those are damaged, that's a significant concern, especially in the horse, who often weighs 1,000 pounds or more and is putting quite a bit of weight on that bony column and on that foot. There are several theories that have sort of emerged in the literature that attempt to explain how laminitis occurs. And there are people in the veterinary community that are working on this. I mean, this is their job. They are doing research on laminitis full time. And in spite of that, we have learned a lot about it, but we still don't understand completely if there, is one sort of unifying mechanism that explains it, or there are several. Certainly the recent literature, I think, has more and more talked about the fact that there are potentially several different mechanisms or causes of laminitis. And historically, there have been four main mechanisms of laminitis that have been proposed, and I'll just run through those a little bit. They're not on my slide here, but the first one is kind of known as the vascular theory. And this suggests that the initial events that occur in laminitis are partially due to constriction of the blood vessels, with the veins being affected more than the arteries. And what happens with this, or what's proposed, is that this constriction increases pressure within the capillaries, and so this results in fluid leaking from the blood vessels into the tissues of the feet. And so when we get this increased tissue fluid pressure, blood flow is then impeded, and then we end up with damage to the tissues in the foot. The second theory originally was called the toxic theory. In my training, it's more recently been proposed as the enzymatic theory, so talking about enzymes working within the foot. And this suggests that the initial insult is damage to the basement membrane of the lamina, likely caused by a toxin, often from a bacteria that's within the horse. But the damage, at least in this proposed mechanism, is caused by the toxin reacting with a group of enzymes within this membrane. And those are called, it's kind of a long term, but those are called matrix metalloproteinases, or MMPs. And those enzymes cause damage in a lot of other locations, but it has been proposed that they do cause damage within the feet as well. And unfortunately, these enzymes likely result in separation of the laminae within the foot, which causes damage. There's just a couple other theories that have been proposed. The third one is the metabolic theory. Some of you may be a little bit familiar with the metabolic syndromes, the diseases that are emerging in horses. And so this proposes that damage to this basement membrane in the foot is caused by altered metabolism. So changes in glucose, changes in insulin. We'll talk a little bit more about some of those things later. And then finally, we have the mechanical theory, which states that in certain circumstances, the horse's weight or repeated trauma that's inflicted on these laminae is actually enough to overcome the kind of Velcro that exists between these structures in the foot to hold everything together, and then results in damage as well. So again, there are a lot of theories out there, and a fair amount of work has been done to look at these, but we're still not, still working on trying to figure out, are there one or two mechanisms that can explain all of this, or are there really this many theories? So it's still a work in progress for sure. Okay, so I already kind of mentioned this. So again, the reason the laminae are important are these structures actually secure the coffin bone to the hoof wall. And so that's obviously very important for the horses. When the laminae become inflamed, the tissue is typically damaged to some degree. And this can lead to scar tissue formation, just like when you have a wound, any kind of tissue damage anywhere in the body. And so this can, because you have this scar tissue, which is abnormal, it's not as strong as the initial tissue, this can actually permanently weaken the laminae and interfere with the bond between the coffin bone and the hoof wall. So this is one of the reasons why horses that have had laminitis actually are predisposed to potentially have that problem again. Those tissues are just not as strong within the foot as they were before the horse had the problem in the first place. So hopefully you can see this. I'm sorry if it's a little bit small, but this is just basically a longitudinal section through a leg, just to give you guys kind of a understanding of how the anatomy relates here. So obviously we're focusing on the foot here. This is our coffin bone, this kind of wedge or triangular shaped bone here. And then again, I know it's a little hard to make out, but we have these two types of lamina, the sensitive or dermal lamina, and then the insensitive or epidermal lamina in the hoof wall. So that just kind of allows you to appreciate the relationship of the anatomy there. So we get, I think as veterinarians, there's a lot of confusion about laminitis versus founder and what the differences are between that. As I said, laminitis refers to inflammation of the laminae, and usually we use this term to describe the form of this disease that does not involve rotation or movement of the coffin bone within the foot. In other words, the horse just has laminitis. They still have a lot of pain that goes along with this, but the coffin bone in relation to the hoof wall has not actually shifted at all. Whereas a horse with founder, that's not the case. They have all those signs of pain and inflammation, but this tends to be more serious in that the coffin bone either rotates or sinks within the foot, so it actually becomes displaced. So that's the kind of the key difference between those terms. And so laminitis can affect one or all of the feet, and this typically depends on the cause. It's most often seen in both front feet. And I just actually came across an article from one of our journals, Equine Veterinary Journal, the other day, a group that looked at the response in the hind feet compared to the front feet. And it was kind of interesting because these were horses in which they experimentally caused laminitis, but they found that the inflammatory mechanisms in the front and the hind feet were very similar. And so they proposed potentially that in horses that are systemically ill, for example, it's potentially a function of the weight bearing, because horses do bear more weight typically on their front feet compared to their hind feet, and that might make the difference why we typically see this in the front feet as opposed to all four feet or just the hind feet. So again, we talked about this a little bit, and this is just kind of a diagram showing you how the coffin bone can rotate within the foot. The reason that we see rotation so commonly, this structure, hopefully you can see that running down right here, this is the deep digital flexor tendon, and it actually attaches to the coffin bone. And so when these laminae become inflamed and weakened and compromised, we still have that constant pull of the deep digital flexor tendon on the coffin bone. And so now that tendon's continued to pull, and it doesn't have the normal strength of those tissues to oppose it. And so that's why we normally see this rotation. And of course, a real serious consequence of this is that the bone can actually penetrate the sole and come through the bottom of the foot, which is obviously something that we want to avoid. It can also have the case where the laminae give way or become weakened all the way around the bone, and those are horses that we call sinkers, because that coffin bone just sinks within the foot rather than just rotating, as you can see here. So a couple different scenarios that can occur there. So again, we're not sure about the exact mechanisms, even though people are working on that very diligently. But we do know there are certain events that can precipitate laminitis or cause it. And the underlying cause often, not always, but often is from a disturbance somewhere else in the horse. So I'll kind of talk about some causes to be aware of there. So there are a variety of causes that have been identified. Certainly digestive upsets. Hopefully nobody has too much experience with this, but a horse that has had grain overload or has a really sudden dietary change, that can definitely cause laminitis. What happens with this, for example, in the case of grain overload, the horse takes in, ingests a lot more grain than they normally would, and as this is processed, it actually decreases the pH in their intestinal tract. Because of that change, some of the normal bacteria in the GI tract are killed because they can't survive at a different pH. And some of those bacteria release toxins, so that kind of goes back to the whole toxic theory. Those are able to leave the GI tract because that barrier, that normal barrier that exists in the intestine gets compromised, and then we end up with laminitis as a kind of a side effect of that. Also, horses that all of a sudden have sudden access to a lot of lush forage, which unfortunately or unfortunately, depending on how you look at it, we have very good grass in this area. So this is something that we see very commonly. And something to keep in mind. It's always best to kind of gradually introduce these guys to pasture, to lush pasture especially. And you may have heard this called grass founder as kind of a layman's term for that. So again, really, most of these conditions do result in toxins that are released within the horse's system, which is kind of a precipitating event. So a horse that has high fever or becomes very sick, horses that have severe colic or diarrhea, which can certainly be for a variety of issues. And also mares that retain placentas. If they're not able to get that placenta out of there, that becomes a source of toxins as well in the horse. So those are some important causes to be aware of. From a mechanical standpoint, you may have heard of road founders. So when horses have excessive concussion to the feet, they can develop signs of laminitis as well. I think more commonly we potentially see, or at least in a hospital setting, we worry about support limb laminitis. In other words, if a horse maybe has fractured a limb or seriously injured a limb, they don't want to bear weight on that limb, so they put more weight on the limb on the other side. And so we can certainly overload that. They can overload that limb and develop this support limb laminitis. Various primary foot diseases could cause it. Again, maybe not quite as common. Certainly black walnut shavings, there's no doubt that if horses are bedded on that, they can develop laminitis, so that should definitely be avoided. And then this last point, we spend a lot of time, I think, talking to people about. Certainly, it's been suggested that there's this relationship between prolonged or high doses of corticosteroids and laminitis. And there was a very good review article about this, again, in one of our publications from 2010, that kind of went through all the literature that's been published and looked at this relationship to try to figure out what's actually been shown in the literature. Most of the work that's been done, not all, but a lot of it, has used the steroid triamcinolone, which some of you may be familiar with. That's one of the most common, question.
High dose.
I'm going to talk about that in just a second. Good question. So again, these papers looked at triamcinolone, which is one of the steroids we commonly use for joint injections. There wasn't, not quite as much work done looking at, dexamethasone and some of the steroids that we use systemically. But they did find, looking at triamcinolone, that, again, it's kind of circumstantial. There have been some case reports published. But what's been shown is that very high doses, so 8 to 10 times what we would consider a safe therapeutic dose, had to be administered in these horses to cause it. Now that's not, I'm not here to tell you that it can't happen under any other circumstances, and it has to be taken as a case-by-case basis, but it's not been terribly commonly reported in the literature. But again, I think it's a relationship we still have to be aware of, and kind of be judicious with our steroids, depending on the horse and their metabolic state and those kinds of things. So we'll go through some risk factors, and these have been shown to either increase a horse's susceptibility to developing laminitis or to increase its severity if it does occur. So horses, our heavy breeds, as well as some of our small breeds, Morgans and donkeys, have been shown to kind of be more susceptible to laminitis. As we mentioned, endocrine diseases definitely are risk factors. And there's actually been an association between insulin resistance and the development of laminitis. This was first documented 20 to 30 years ago, and many subsequent studies have provided evidence, to support this relationship. I think it's interesting to note that laminitis has actually been caused experimentally in horses that are sensitive to insulin. In other words, they don't have insulin resistance. And in these studies, they use prolonged infusions of insulin to produce higher than normal levels in the blood. And so this has shown or suggested that insulin itself, rather than the condition of insulin resistance, might be responsible for the development of laminitis. And so, again, we're not totally sure at this point what that mechanism is, but there are groups of researchers that are working on this relationship and trying to determine how exactly those high levels of insulin in the horse cause laminitis. So again, we see that fairly commonly around here too, these horses that have high levels of insulin. So I think it's important to be aware of that. And then, as we've already mentioned a couple times, horses that break into the feed room and get a lot of grain. This is definitely an emergency and not something that you should wait on. If this happens with your horse, you should call the veterinarian right away, because it's one of those conditions, as with laminitis, that the sooner we can get to it and get them treated appropriately, the less likely they're going to have long-standing effects, and laminitis being one of those. So horses that have had previous episodes of laminitis are often predisposed. We'll talk a little bit more about that in a few minutes. And then older horses with Cushing's disease, again, dealing with the metabolic issues that they can have.
There's a question.
Yes.
Question.
Yes.
What do you do when you're called to a horse that has just broken into the grain bin and eaten half a bucket?
Yes, good
what
question.
do you do?
Good question. There are a couple things that we do. So of course we start with a physical exam and kind of check the horse's systemic status. Assuming that they're stable, I will always give them a dose of Banamine as an anti-inflammatory. And then probably the most important thing we do is we get a stomach tube passed on that horse. And if they have truly eaten, half a bag or a very, very big quantity of grain, we'll lavage as much of that as we can out of their stomach, and then also give them some mineral oil, because that acts as a laxative and helps to just, we hope that they'll pass that grain quickly out of their system. It'll move through there and not have the time to, alter the pH as much and kill the bacteria and do that kind of damage that I was talking about earlier. So, you're welcome. Yes?
Do you give them water?
If they have gotten into the feed room? You mean as the owner, do you do that? Or?
Yes.
I don't think it would necessarily hurt anything. Hopefully the vet's going to be there within, an hour or so, but I don't think that it would, change the outcome necessarily one way or the other if you did or not. I think that that's an okay thing to do. So, all right, nobody else for now. Okay. So signs, this is important, and there's a wide variety of how these horses can present. I've seen horses that are significantly lame, there's no question about what's going on, and then I've seen a few, and even since I've been at Piedmont, that they just have kind of a tentative gait. They're not showing you a lot else. Sometimes they're not, super positive to hoof testers if you catch them right away, and so it's really important, to pay attention to the horse's gait. And any changes, I feel like should be brought to somebody's attention. But typically we do see some lameness, and when they're turning in circles, because it is within the feet, that really brings it out. Also, these horses often they want to shift their weight, so they're kind of constantly shifting when they're standing in the stall. And we typically, again, these are, I think, more common presentations than the horse that just has a tentative gait, but We'll see pain in the toe region, so just in front of the point of the frog when we put hoof testers on their feet. And we will often have increased digital pulses in the feet, or foot or feet, and heat as well. Again, some horses will just show you this kind of reluctant or hesitant gait. And then very classically, as this picture shows, is a horse that develops this sawhorse stance. So they're trying to get their weight off of those front feet that are hurting them so much. And you can see that this horse has his back feet, camped underneath him in order to support more of his weight. So he's not, so he's trying to get the weight off what hurts, basically. Okay, so moving into chronic laminitis, and I do have a couple of specimens here that I brought in that again are sections through the leg, a couple of examples of chronic laminitis, so if you all want to look at those afterwards, feel free to do that. But signs of a horse that has had chronic laminitis issues, these horses often will have rings in the hoof wall. I'm sure most of you have probably seen a horse that has this kind of a sign. Sometimes they'll also have some changes on the sole, so they'll have a widened white line. They may have seromas, which is kind of a blood pocket, and or abscesses in the feet. And again, this kind of has to be taken into account with the rest of the horse's history to distinguish it from seedy toe or white line disease, some of the other foot problems that they develop. So some of the other signs we'll see, sometimes horses will have dropped soles. And again, this is probably a horse that's had some chronic issues with laminitis. This can actually indicate that the coffin bone has rotated or shifted position within the foot. And then, as we've talked about, horses with metabolic disease, which are often seen as these crusty-necked horses. This is a prime example of one on this slide. They're often more prone to develop laminitis or founder, but it's not to say that they all have had it in the past. So this is an extreme example. Hopefully not too many of you have seen a horse with this kind of feet, but they often will develop some sort of dishing of the hooves. And again, this horse obviously has not been trimmed for quite some time. But the reason that this happens is the heels tend to grow at a faster rate, and that gives us this kind of slipper appearance that they develop. So that's, again, this is an extreme example, but just to kind of show you what can happen over time. So we'll go into treatment a bit, again, just sort of covering the basics here. And certainly the more proactive and the sooner the horse can be treated, potentially the better chance they have for recovery. And each case is a little bit different, but there are some basic things that can be applied. Certainly diagnosing and treating the primary problem is very important. And then the second point talks about icing the feet, which we often do. What's been shown in the literature actually is horses that responded to this had to be iced, basically placed in ice water, their whole distal limb for 72 hours, and that's how it was effective. So obviously in some real world circumstances that isn't always going to be a possible thing to do, but I think some sort of icing is important. It's an anti-inflammatory treatment. It can also slow down enzymatic activities and those kinds of things in the feet. But again, what's been shown definitively to make a difference is to ice the whole bottom part of the limb, which isn't always maybe the easiest thing to do on the farm. And then dietary restrictions, basic but very, very important. The horse should be off of grain, off of lush pasture. All of those kind of rich sources of nutrients should be taken away. And typically only grass hay. And sometimes even a poorer quality, not to say that it's a bad hay, but maybe a stemmier hay that's a little less nutrient dense. I've certainly recommended that. Sometimes these horses are overweight and they need to lose weight anyway. So if we put them on a little bit of a diet and give them some hay that's maybe not quite as good, that can help as well. We talked about treating with mineral oil if they have grain overload. And then obviously non-steroidals, typically phenylbutazone I think is what most of us would reach for, at least initially, are very important to control pain and inflammation, try to get the horse a bit more comfortable on their feet. There are some other systemic treatments that some people will use as well. DMSO, fluids, and also this mentions antibiotics and anti-endotoxic medications. I think that more has to do with the primary problem that the horse has and trying to treat them for that too. And again, we don't recommend corticosteroids because there is, that link. not terribly common, but there's still that potential link between it and the development of laminitis.
Question, please?
Yes.
Do you prefer butte to Vanamine?
I do. At least initially, I've had, I mean, it may differ depending on who you talk to, but butte, you know, typically seems to be pretty effective for them. So I don't think giving Vanamine is wrong, and there probably are some horses out there that may respond better. In my hands, I feel like the horses have typically done better on butte. So, all right. Okay, talk about footing a little bit. I really think sand is the best footing that you can put the horse on if that's possible. The reason this is so good is it really promotes sharing of the weight between the whole solar surface of the foot. So the horse is not primarily putting the weight on the wall, which is going to be compromised because of what's going on inside the foot. It distributes that weight-bearing surface, and that really, I think, helps from a mechanical standpoint and also potentially from a comfort standpoint. If you can't do that, then it's definitely advisable to bed the horse as deeply as you can. And this will promote that load sharing to some degree, maybe not as effectively as the sand, but it's still important. And also, bedding them more deeply might encourage the horse to lie down. We can't, you know, it's hard to make them do that, but if they will do that, it definitely gives their feet a break, and that can be very helpful. And you know, you'll find that a fair number of horses that have maybe been dealing with this for a while will figure out that that's a good thing to do. So proper foot care is very important. You know, oftentimes the horse, we have to get them through that really painful kind of acute stage, but once that has occurred, then it's good to have a good working relationship between your veterinarian and the farrier to provide that foot care, work together and make a kind of a therapeutic plan for the horse. And it's important to know that most horses will take about a year to grow a new hoof, and so therapy may last that long. In some cases, it may last for the rest of the life of the horse. It just depends on the case. So I think that's important to be aware of if you get into something like this. So the long-term outlook, there's a wide range. I wish I had more definitive information for you, but it is really kind of a case-by-case basis. Some horses recover in fairly short order, and they go on and they're functional again and they don't have any further problems. And unfortunately, other cases, whether they're chronic or they just have a very severe insult, you know, we end up having to euthanize those horses, unfortunately. So again, it's kind of the full spectrum as far as how they can do after this happens. So, yeah, I'll just kind of skip this one because we'll go on to the next one. So radiographs are really important, and I think it's important to take the radiographs at the time the laminitis is recognized so that there's a baseline, and then, you know, depending on how the case progresses, the therapeutic shoeing that's elected, those kinds of things, and also as the owner to make further treatment decisions. It's important to see that because as you can see from this, that's the only way that you can really tell, you know, get that relationship between the hoof wall and the coffin bone. And obviously this horse has some rotation happening, but you know, having those repeated radiographs as you go along, I think is very important. And so we've mentioned this a couple times, but once a horse has suffered from laminitis, it may be more likely to recur, and that's for a couple of reasons. Again, as I mentioned at the beginning, if the laminae are damaged enough, they may never regain their original strength, and also if the coffin bone has rotated within the foot, that can change the mechanics and those kinds of things and can predispose them to have a recurrence. They're also, you know, potentially there may be interference with blood flow to the feet as well as ongoing metabolic changes in the horse that may predispose them to have laminitis in the future as well, and not just one episode. So, talking a little bit about management, we've mentioned this a couple times, but modifying the diet is very important, and so high quality forage should really be the staple of that diet. Potentially adding in some digestible fibers such as beet pulp and some fat, but definitely avoiding carbohydrates, and particularly from grain, is very important in managing these horses. And then, as with any horse in general, but especially important for these horses, is routine and proper hoof care, and just maintaining a good health maintenance schedule too. So you make them less likely to, you know, have some of those systemic problems that might predispose them to laminitis. And then, as far as using a supplement, I think that is a little bit dependent on the, you know, individual veterinarian and their preferences. If they've had some success with some of those, so that's a little bit variable. But certainly avoid grazing lush pastures, that's very important. Between the late morning and late afternoon hours, typically in spring and summer, is the time where the plant sugars are at their highest. So those horses that have had laminitis shouldn't be out during those times for sure. And again, restricting pasture intake during the spring season or any time the grass springs up is important too. I always say that the grazing muzzle is your friend. Or if a horse has had some chronic problems with laminitis, sometimes those horses have to be in a dry lot situation. It just kind of depends on the case. But we have to be careful here, you know. I'm sure you all know it. Again, our pasture is so good that it's important to be aware of these kinds of changes that occur during the spring, particularly. So the best way to avoid laminitis, this may be one of the most important, if not the most important slide of the presentation, is to prevent it. And that's really the key. I think if you can prevent it, that's, you know, by far going to be the best thing for the horse. And as far as causes that are under our control as horse owners, keep all grain stored very securely. You want to keep it out of reach of horses because we all know that they'll go for it if they can. And again, a gradual introduction to lush pasture is very important. And horses that are ill, under stress, or overweight are definitely at increased risk potentially to develop laminitis. And so, you know, as far as the overweight issue goes, unfortunately, kind of like with people, there's not really a magic answer for how to keep a horse from being overweight, but maintaining a sensible diet, so a diet that's not really high in carbohydrates and lush feeds, and keeping the horses at an adequate level of physical activity. I mean, those are just the basics, but they're key to keeping a horse at a healthy weight instead of too heavy. So. And your veterinarian is a great resource, I think, probably the best resource to formulate a proper management plan for the horse, which goes for everything, not just this topic. And kind of the take home, I think the last point is, if you think that your horse might be suffering from laminitis, if they are showing some of the signs that I've talked about, you definitely want to call your vet right away. It's something that the horse should be looked at right away and get started on appropriate treatment. So that's another take home from that. And these are just a few slides at the end of this presentation, which AAB supplies us with. I didn't put that there, just but this is a little bit of information about their foundation too. And then the last slide I wanted to make you all aware of, like I said, you know, your veterinarian is a great resource. I also think that the AAEP website, which is the American Association of Equine Practitioners, there are some really good resources there for horse owners. And so I would encourage you to check that out because it's a good resource as well. It might provide you a little more literature and those kinds of things on various topics. So, Patty.
It's bad when you use my name, right?
Not really.
I have a question regarding keeping their weight under control. And so, like, my horse is a little overweight, is not extremely overweight, and I try to decrease his grain. Do you recommend just giving him hay and pasture and then eliminating grain? Because I've heard some people say they still need some vitamins that they may not get from that.
Well, I do. I mean, if a horse is not in consistent or heavy, you know, kind of heavy work, they don't necessarily need grain. I mean, honestly, good hay and the pasture should be the foundation of their diet anyway. And if they're getting good hay and good pasture, their nutrients will basically be accounted for. I know some people, you know, will give them, you know, a mineral block or something like that. I don't think there's anything wrong with doing that. But again, if it's good forage and good pasture, they should have everything they need there. And especially for maybe a horse that's, you know, not working really hard, I think that's how I would manage them for sure. So.
I'm a fan of the balancer pellets because they have the vitamin mineral premix in a more concentrated, in a higher concentration in the grain, and it keeps them easy to catch and happy to see you.
That's good to know. Good to know.
And if you're feeding everybody else in the barn and you don't give them anything,
They might be
hate you
upset
for
with
life.
you. That's right. That's right. That way you don't have to give them grain, but you can give them something. So, yes.
I just wanted to throw out that another option to feeding grain is what I do for my overweight horses. I just feed them hay cubes
Yes.
And then he's included in the feeding process, I just soak him
So
and,
he doesn't feel
Right.
frustrated.
and
Yeah.
add a little, he gets a vitamin supplement in that.
So I don't know if you all heard that in the back, but she was saying she feeds her horse hay, not grain, but hay cubes, and he gets that when everybody else is fed, so he feels like he's part of the feeding process, which is important too. So
Excuse me, I seem to have my mouth open always, I apologize.
that's
but
fine. That's
is-
fine.
Do you know, is there any science out there about magnesium, chromium? There's a product called Emission, I'm not plugging anything, but do these have any effect at all? Is there any science to show that they do?
As far as, are you talking
As
about
far
for
as-
feet or?
Preventing laminitis, attacking the digestive process before it
Right.
starts.
I am not familiar with it. I guess I'd throw it out to some of the partners that are here. I don't know if they're aware of anything that's out there about magnesium or chromium and laminitis.
Well, I thought there might be another partner who had more
Oh.
specific information.
You don't want
I'm looking at Joe because I can never
I
say.
don't think there's any evidence that they prevent laminitis. I did see a study that suggested that it changed their, I don't even want to quote it because I don't remember. It did have some effect, but not a significant enough effect to prevent laminitis. I mean, I think one of the hardest things, looking at your overweight horse, is saying, is this horse at risk of laminitis? Well, yes, it's at risk of laminitis. But there's no line there that says, tomorrow, you're in trouble. You know, today, you're okay. And I think a common thing, maybe, it's not uncommon to say, to have the client look at you and say, well, he's looked like this for years, and why did he found it now? And you're like, they say he's been the same. Well, he's not the same, he's a year older, and so I think that's, it's a risk factor that if you're overweight, there's no likely founder, but, you know, there's no red line to say, oh, you gained 3 pounds and now you're in trouble.
Right. Yes.
Are there any tests or diagnostic tests to say whether your particular animal, say he's not overweight, but he's a chunky build horse, he's
Right.
not fat, is he going to be more prone to laminitis?
Well, there are definitely some blood tests that we can do to assess the metabolic status. You know, if you're looking at things, again, I know around here and probably in a lot of other parts of the country too, we look at, you know, insulin and glucose, and especially those insulin levels. Because as I mentioned, that has actually been shown to have a relationship in causing laminitis, even though we're not exactly sure about the mechanism at this point. But certainly, you know, there's several tests that we can do to test for Cushing's disease, which often occurs in the older horses, and they develop a set of signs. You saw that horse on the slide that had that real curly coat. I think most people know that that's pretty classic, although they don't always get that, but that is pretty classic for that. And then, like I said, you know, looking at insulin and glucose, things like that. So that's a, you know, and that can definitely be an indicator. Sometimes we, yeah, I guess that's what I can say about that. So yeah, there are definitely some other things, even if they're not, you know, horribly overweight, but you're concerned that because of their build or that kind of thing, there are some other things you can look at. So, yes.
I'd like you to talk a little bit more about the use of dexamethasone and the rumor of it causing founder and show horses in silver breeds.
Right. Well, like I said, and I may have to defer to Joe a little bit more on this, but the review article that I looked at, again, I'm only speaking to you from what's in the literature. I know there are probably individual cases out there that maybe haven't been reported, but the bulk of the papers, and again, those are there are some series, but it's mostly case reports, which means that it's just a horse here and a horse there that received a very high dose of triamcinolone, which isn't the same steroid, you know, as the Dex. Those are the ones that they really focused on in this paper. And again, I think that's because not that there is a huge amount of literature about that, but there was more about that. There has been more published about that than about dexamethasone
So
specifically.
there aren't really any studies out there about dexamethasone and.
I may have to look it up. Like I said, I will look it up. I have the book here, but I can look it
The
up.
question I have is not only the use of dexamethasone, but if it's the use of dexamethasone in combination with several joint injections every year, if that could be the end result.
Right, and potentially, yes. I mean, I can't tell you 100% either, but I know that, anytime there's a very long course of steroids, I mean, I know in my career thus far, I have seen at least a couple of horses that I can think of that were on, I think one was on Dex and one was actually on prednisolone, and they were on it for a very long period of time, longer than just to treat a respiratory disease or hives or the things that we will often reach for steroids for, cellulitis, things like that. And those horses did, the ones I can think of did develop laminitis. And I'm sure most people have stories like that where you can think of it. There's just not a lot in the literature, which was surprising to me going back and looking at it again. Because I thought, well, it's been a couple years since I looked. Maybe there's more now, and there just hasn't been a lot more published about it since the
I
last
would
time I
love
looked
to
at
know
it.
more about that, because I know a lot of people use dexamethasone just as like, this is their drug menu, this is what
Right.
they need to show on, this is what makes them try it.
Right.
And I am on a committee for horse welfare for the United States Kennel Club Association.
Oh, okay,
And
okay.
I would love to have more educational literature so people just don't.
And I can help you with that. Yeah, like I said, I know it did mention it. I know the article that I talked about here did mention it, so I can certainly, I can get you a copy of that. I mean, I can look at that again, and there's a lot of references that go with that too, so, absolutely.
There are always a lot of other factors in the show horse that contribute to laminitis. A lot of times the show horse is particularly heavy. They have stressful lives, they travel a lot. So it's usually a multifactorial, or thought to be a multifactorial thing. And you certainly, we've all had the experience, we as veterinarians, of injecting the horse and having found her twice, maybe, I think it's happened to me. And there usually was some risk factor up front that I was concerned about. They were bad. There was something else going on. So it's hard to say for sure what it was.
Right. Well, it just sort of disturbs me a little bit that in my business, because I am a show horse trainer, that people just say, oh yeah, I use toxin every 6 months, or I need it every 3 months, and then they use the drugs and everything else, and then these horses don't last very long. My horses don't get injected, and I don't use Dex, and they are, do pretty well. So to me, it's just about educating the public on, is this really necessary, and only use it when it's absolutely necessary with diagnosis before you inject, and it's not like, oh, they need it every 6 months.
So, I agree, but it is not cumulative over the course of years. So the association with Dex or any corticosteroid with laminitis is weak. It's not like we can go give 20 horses a huge dose of Dex and 15 of them are founder. It doesn't happen. There seems to have to be some predisposing metabolic condition. But even in a horse that's prone, the triamcinolone is going to have a systemic effect for about 10 days. The methylprednisolone, which doesn't seem to be associated, that's going to have, which is what we usually put in their hocks, that's going to have a systemic effect for 2 to 3 weeks. So, yes, you are at some increased risk immediately after you inject it. But the next time around, you're back at square one. So we don't need to worry that it's accumulating in your system.
Yeah, so that, I guess I could have clarified that as well, but just like Dr. Davis said, a kind of prolonged course tends to be for, in the same time frame, whether that's a few months or, so yeah, so it's kind of one episode or one treatment period rather than over several years. Yes. Oh,
I was gonna ask something.
sorry, I'm trying to do it in order. Go ahead.
If you've got an older horse who tends to be heavy, does putting him on like the low carb feeds, I've got one he's older, he's a warm blood. I keep him on low carb feed, but he's on thyroid well at the same time, so, what do is that the right thing, keep doing it through the low carb feed, is that helpful?
Well, let me ask you this, is what kind of body condition? I mean, is he hard to keep weight on, or is he, no, very easy.
Show the right feed, it will gain weight.
Yeah. Well, definitely, I mean, I think the low carbohydrate aspect of it is definitely an appropriate thing to do. Again, he may or may not need grain. If you've got some, decent hay, again, he's not gonna need alfalfa or anything like that because he sounds like he's an easy keeper. But if you've got
1 cup twice a day,
Yeah.
1 cup.
So, it's not like he's eating a ton of that. But again, I think if you've got nice Timothy hay or grass Timothy or, whatever you have, some sort of grass hay, that potentially that's all that he needs. And, maybe, again, if he's with other horses and he's going to have a fit at feeding time, you might need to give him just enough to keep him. And I know some people will give him just enough to give him supplements and that kind of thing. And again, if you have to do that, I think that the low starch or low carbohydrate feeds are a very appropriate way to do that.
And that's sort of where he is, everybody else in the barn is getting fed, and if he's not getting fed.
Yeah, I think, that amount shouldn't really tip the scale, so to speak, one way or the other. So I think that that's fine. Yeah. Yes.
Is there any research, or in your experience, have you found that horses that are on pasture 24/7, do their bodies tend to adjust to the change in the grass, the spring particularly, better than those that are not, so that you don't have to worry about laminitis as much?
Well, just thinking about if I've ever read anything specifically about that. What I was going to say is, anytime they have an abrupt change, and that relates to pasture as well. So in other words, a horse that's you never want to take a horse that's not been on pasture and throw him out even for like 6 hours, when the pasture's greening up or something like that. That might be too much for some horses. So it has to be a very gradual transition. But in saying that, I can't actually think of any literature off the top of my head that I've read over the years that looks at that specifically. But certainly there are a fair number of them that are out there that are fine, so I wish I had more information about that. Again, I think it just has to be kind of a gradual thing, and if they are out there a lot of the time, they may be able to, it'd be kind of a more of a gradual transition for them than a horse that's locked up and then suddenly gets chucked out on the pasture, so.
But just like you all said earlier, other factors, if you've got one that's out
Exactly.
24/7, it doesn't have stress, it doesn't have all these other things.
Yeah, that's very true. So,
So
yes.
when the horses come back from Florida, how long do you suggest to put them out? Because the grass is green, when they come back.
Right. Well, and again, you have to look at the whole picture and go, okay, let's look at this horse and see too, are there other predisposing factors? But I'd start them pretty conservatively. Again, if you can avoid those, the times when the plant sugars are highest, typically it's been shown are between kind of late morning and late afternoon hours. So maybe if you're going to put a horse out, the days will be longer, and you could either put them out early in the morning, maybe start them out for, again, every situation's a little different, but I'd start them out for maybe an hour or so, and then just kind of gradually. It's just all needs to be gradual. There's no really black and white clear cut, but several weeks, certainly I think for them to adjust if they're not used to being out on that. And keeping in mind when those plant sugars are highest, that would be the time of day that you would want to sort of transition them to maybe last. Or if you're concerned that they may have a problem, you may have to kind of split their turnout and they may not be able to be out during those times. So. Anybody else? Oh, yes.
Yeah, the time of year. Like he's out now in the daytime. But then, when we get to be spring, then we've got the sugar content issue. So he'll have to transition to being out at night instead of in the daytime.
Right.
Is
Which
that
is,
right?
I think, a lot of people do that, as they get towards summer, certainly as well. But spring is probably more of a concern because you've maybe got just, looking at the grass, you've got maybe a bit more of a drastic transformation. Because right now, finally, most everything looks kind of dead. It took it a long time to get there
he's out
this
all
year.
day and he's fine.
And then in the spring, everything kind of, you have those periods where everything just shoots up. And so I think you kind of have to take that into account. And again, if it's a horse that, has some other predisposing factors that you're concerned about, just to kind of keep that in mind along with what the pastures do.
I was trying to avoid the muzzle, and I was trying to think of a way to do it.
Yeah.
I
I know they do. My horse wears a muzzle too and he hates it.
Yeah.
But I do it because I just use a draft cross and I don't want him to have.
Well, it's a warm blood
problems,
thing,
so.
right? Because I never had this with a thoroughbred, but this guy is half warm blood. And
Yeah.
it seems to be more with that.
But I think I know easier said than done, but definitely, I think that transitioning them to where they are out, out at night during the summer, spring and summer when it gets warm too. I mean, from a climate standpoint, it's better.
So he could
for him
avoid
too,
the
so
muzzle by being out at night.
well, yeah, as long as you do everything gradually. Again, maybe he would need that, sort of during the transition period as you sort of change your times around. But
Right.
you would like to, hope that maybe if he's not had a problem before, you can gradually
Well, he
increase
has,
that.
that's why I don't want to repeat.
Yeah, you don't want to have those problems again.
Uh-uh.
Yeah. Yeah, no, it's a good point. And again, every case is a little bit different. So it's you'd like to avoid the muzzle if you can, but there certainly are, I think, a fair number of horses that they do benefit from it, even if they don't think so. So it does makes us feel better that we're doing what we can to, prevent them from gorging, which of course, besides laminitis, can potentially cause them to colic and have some other issues potentially. So
Yeah.
When you talk about the times of the day when those sugars are at their highest point, I understand all of that. Do you know if rain does anything to fresh, wet grass?
well, I know about. Maybe I'll tap Joe up too. I mean, obviously, if you get rain, I mean that's mainly because it affects the growth. It's when you have the growth, that's what affects the sugar content of the grass. So I don't think that the rain itself changes a lot, but just the fact that it stimulates the grass to grow is the concern.
Okay.
So
Yeah, the sugar's at the base.
that's right. Anybody else? Oh,
And
Patty.
the fescue grass, don't they worry about the endophytes or something as well?
Yeah,
'Cause they sell the grass that has low endophytes and stuff like that. So.
And that's mainly a concern in pregnant mares. When I was in Kentucky, we had to worry about that a lot more with the fescue there. So that actually, mares that are exposed to the fescue that has a particular endophyte are more likely to have what we call a red bag delivery, where they the placenta separates prematurely as the foal's being born, and it can be a bad deal if there's not somebody right there to attend the foaling, because it's kind of getting off topic, but the placenta has to be open and the foal, get gotten out right away because they can't breathe and that kind of thing. So that's a serious thing if you're breeding mares. And again, I think there may be some of that around here, but I know my understanding is not as much of a concern as Kentucky, although it's still a concern when you've got pregnant mares. That's the main thing that we worry about in terms of the fescue, if you're breeding mares or you have mares that are going to foal.
And then regarding the black walnut, you talked about specifically about the shades and the absorption. What if they're on the trails and everything? You don't have to worry about them walking on that stuff.
I don't think it's as much of a concern. I mean, I guess ideally you want to avoid it, but I think when they're standing around in it, for long periods of time, like in a stall, is when it is more of a concern. So that would be, I guess you can only do so much on trails and that kind of thing, but that would be the biggest concern, is just to avoid bedding them on it so they don't have that prolonged contact and then the absorption that way.
Aren't cherry trees considered part of that? It's just as bad as...
Well, cherry trees, yeah, so they can actually cause a toxicity in the horse. And again, anytime you have compromise of the horse systemically, which that can cause, then potentially you could get some laminitis to go along with that. So I know it wasn't specifically mentioned here, but there are a lot of diseases that can make them sick enough if they have, get toxic and those kinds of things that you worry about their feet. We always think about that when horses come in here and try to address that before it becomes an issue too, if they're really sick. So. Okay, thank you for coming.
Well,
What do you
registered
do that
officer
here and
Now I know what the coffee is all about.
yes.
Before everybody leaves, before you leave, I want to say thank you for coming. I'd like to thank Vintage Ridge Winery for pouring our wine tonight. We've got a couple more seminars coming up. We've got I may not have the dates perfectly right, but on May 26th, Dr. Ducty's going to talk about emergencies. And then April 6th, Dr. Chrisman, who's been here before, is going to come talk about Lyme disease. And then we've got something that is brewing. We're going to put together a talk on regenerative medicine, so stem cell, PRP. That's going to happen in the summer sometime. That's it. Everybody drive carefully. Thanks for coming.
Thank you.
Why do we have the car?
Old Jag. Yeah, it's up to you. Take care.
This is on the personal website if you want to see some of them. Sorry. Trying to get it. Go ahead.
Yeah. Hey! I saw Charlie back there. You didn't see me. Well, you were back there. I was. I mean, I just stood up and saw. Hi, puppy. Oh, just now. Yeah. Hi, puppy. Stop this camera here. Just wanted to come tonight.